Good morning. We're delighted to have been asked to present to you about Lanarkshire Falls strategy, Falls, Frailty and Bone Health. As you can see from the many logos displayed on this screen, a number of partners have been involved in pulling the strategy together. So some introductions. The Specialist Falls team is a small community-based team with us being based in Glendoe Building at Coathill Hospital in Coatbridge. The Falls Register Hub staff, which comprises of 2 Band 3 APRs, sit with us and we supervise and support their work. So you'll see from the picture and down below you'll see us periodically at the bottom of the screen. The team comprises of 3 clinical staff. So there's myself, Sandra Lawler, I'm the physiotherapist. There's Ruth Muir, the occupational therapist, and Angela Scott, the nurse within the team. The team initially was established in March 2003 on a very small scale within Coatbridge, Airdrie and Cumbernauld. Our remit has now expanded to cover community across North and South Lanarkshire. And we have been very heavily involved in the vision, design and now the implementation phases of the Falls strategy, which was ratified in the summer of 2020. So why do we need the strategy? There was a very disjointed approach to falls prevention in Lanarkshire. So the falls strategy sought to set out a common approach and purpose to tackling the incidence of falls across Lanarkshire. Harm from falls and fear of falling affects a large number of people, both directly and indirectly, and it has a significant impact on well-being and prevents many people from experiencing healthy ageing. In Lanarkshire, there are approximately 37,500 people who fall each year. Many of these falls occur in their own home or in care settings. NHS Lanarkshire and North and South Lanarkshire Health and Social Care Partnership and other stakeholders are committed to delivering a whole systems approach to the prevention and management of falls, frailty and fractures, with a shared vision for Lanarkshire being that people live a life free from harm from falls. Lanarkshire is very much leading the way nationally, with the Scottish Government National Falls Strategy having stalled during the pandemic. But within Lanarkshire, we have forged ahead. We have been careful to align the Lanarkshire strategy to the proposed national strategy, and we have undertaken a very highly ambitious quality improvement project to designing the strategy. A large stakeholder event was held in 2019 at Kirklands, looking to develop our comprehensive whole system approach across community, acute, social care, Scottish Fire and Rescue, Scottish Ambulance Service, leisure and many other third-party organisations. And this has been groundbreaking nationally in terms of its scope and ambition. A huge process mapping exercise was undertaken at this event, which resulted in a sea of post-it notes which filled the boardroom at Kirklands, as you can see from the picture on screen. There was a huge number of post-its and it took quite a while to wade through it all, and we discovered that there's quite a lot of duplicate work going on. There's something like 16 different independent falls groups, each with its own approach. So working with the quality improvement team, we then had the huge task of sorting through this sea of post-it notes and putting them into themes which aligned to the proposed National Falls Strategy, which we've adopted in Lanarkshire. So the ambition for Lanarkshire, our shared vision, is where possible, more people live a life free from harm from falls. And this aligns with the national strategy that's proposed, and it very much builds upon previous strategy work that's ongoing in Lanarkshire, dating from as far back as 2014. So I'm not going to go into the aims too much because Angela's going to follow on and she'll go into it in more detail, but the main aims are to build an integrated approach, build resilience at population level, take action earlier, and targeted evidence-based and personalised support. The strategy aims to create a culture where the prevention and management of falls, frailty and fractures are addressed across a lifespan from early years to older people. And underpinning quality ambitions are to deliver safe, person-centred and effective care. So to achieve these ambitions, driver diagrams for each theme were developed with change ideas, and we're now moving towards the implementation stage. So I'm now going to hand over to Angela, who's going to guide you through the change ideas and the driver diagrams.
Thanks, Sandra. From the whole systems process mapping event in March 2019, the Falls editorial group developed a driver diagram for each of the stages of the Falls strategy. Consultations took place with our stakeholders, including patient representative groups, to ensure that there is good foundation for a whole system strategy. Each of the driver diagrams are colour coordinated, and you can see from the slide, stage 1 is yellow, and each stage will have a falls pathway stage identified, and that is the stage of the pathway and definition of that stage. We've got primary drivers, current services and change ideas, and each of these sections were generated from themes and information gained during the process mapping stage. We've got ambitions and outcomes, and that's taken from the draft national strategy. Stage 1 is about the building resilience at a population level. The ambition was to work across the sectors to include individuals and communities to enable more people to maintain and build resilience and reduce their exposure to falls risk factors and osteoporosis, so very much the preventative stage. We've got outcomes 1 to 4, and that's about changing behaviours to prevent falls and maintain good bone health, about participating in regular exercise to maintain strength, balance and bone health, and make sure older people living in homes and communities are allowed to live independently. And it's also about keeping well for longer and avoiding harm. To achieve these outcomes, we looked at what was already available through current services and resources. We had a huge variety of resources available, from the Making Life Easier app, the Falls Register Hub, links to cancer services and activity coordinators in care homes. We looked at change ideas, how we move forward using the resources that's available, but more importantly, what's omitted. Some of the change ideas looked at the transport to support access to local opportunities, bus driver and falls prevention awareness training, alcohol and drug awareness services to increase the awareness of bone health and physical activity and promotion of the self-management tools. Stage 2, the green, was about taking action earlier, and our ambition was to share the responsibility for recognising valuable opportunities to take earlier preventative action when signs of frailty and functional decline are first recognised, and after one fall or a fragility fracture, in order to prevent another. Outcomes 5 and 6 is about more people proactively recognising their falls risk and taking action, and more people take action at a first fall to reduce further falls risk. To achieve this, we looked at the primary drivers such as falls, frailty and fracture risk identification, and IT systems to support a falls pathway. Our current services included community alarms, Scottish Ambulance Service, health and social care professionals, fracture liaison services and acute services as well. Some of the change ideas involved making the falls training programme mandatory and developing the current falls register database. Now we've got stage 3, the pink section. That's the right response and care at the time of a fall and the right care thereafter. Our ambition was to use target, evidence-based and personalised support. Our outcome 7 was people receive the proportionate response at the time of a fall that minimises harm and enables best possible recovery. And to achieve this, we reviewed our current services, and it included the police, Scottish Fire and Rescue Service and the Scottish Ambulance Service, as well as care at home, amongst many others. Our change ideas included working with care at home staff to instruct persons up from the floor and also look at telehealth information post-fall. Stage 4, again, was about target, evidence-based and personalised support. And that was outcomes 8 to 11. And it was looking at personalised falls prevention for people at higher risk and with complex needs. It looked at evidence-based approaches to preventing falls in community settings, hospitals and care homes, and also looking at fragility fracture prevention and personalised care following a hip fracture. We looked at our current services, including the Falls Register Hub, Hospital at Home, Specialist Falls Team and the Falls Clinics. Our change ideas included raising the profile of the Specialist Falls Team, review of the current Lanarkshire-wide training, and also the Falls pathway from the ED departments. Stage 5 was looking at the whole systems approach with an ambition to build an integrated approach. And outcome 12 was working across the system to design, plan, fund and deliver falls and fragility fracture prevention and management. Our change ideas included working with other partner agencies, and there is a common theme here. We're working with Scottish Ambulance Service and Scottish Fire and Rescue to identify those most at risk and on the front line, of course. During the process of review, our current services highlighted many connections already in place across the whole system. However, if we are to deliver our aim, we must work across the whole system to encompass a culture of falls, frailty and fracture prevention, again across that lifespan. Falls, frailty and bone health are complex and require a multifactorial response. I'll now pass you on to my colleague, Ruth.
Hi everyone, thanks very much Angela. So I wanted to share some data analysis with you that we think is quite exciting, because after all QI is all about the data, and what we're showing here concerns the falls register analysis that we did. Now the register is a large database that we are able to hold information concerning an individual's falls and also their falls risk status, what level they're at in terms of falls. And we populate this through level 1 and level 2 and level 3 falls assessment. So that's where we get our information from. And we do know our fallers in Lanarkshire and the community because all this information is held on the register. And it's given us an opportunity to analyse that data to find out the value in these assessments that we're doing. So let me talk you through some of that. And what you are seeing here was done in conjunction with ISD. And they were able to look at the touch points of an individual in 3 months before they came to the attention of the register and in the 3 months after registration. So that's what we're going to talk about. So if we look on the left-hand side, you'll see that it says level 1, and there's some infographics on that page. The little red ambulances represent A&E attendances, and the blue buildings represent emergency admissions to hospital. So you can see for registration, there's obviously a lot more than in the 3 months after registration. And what we do know is that there was a 67% reduction in falls in the 3-month period after a level 1 intervention. When you think that level 1 is just a simple falls conversation and maybe encouraging some self-management, that really is quite striking, I think, just how much we can reduce. For information also on the page, although we'll not dwell on it too much, is the breakdown of the areas, the breakdown of the age and sex in the analysis. So if we move across to the right-hand side of the page, level 2, and here we see a 63% reduction. And I think that's quite amazing when you think not only in terms of the cost saving, but in terms of what that means to the individual. Could make a big difference to somebody and the risk of falls for doing a level 2 investment. And again, you'll see it's all reinforced by the reduction in A&E attendances and emergency admissions. If we move forward, you'll see level 3 on the left-hand side of the page. And even at this level, we see a significant drop in falls. And it's important to remember here that these are the frailest, most high-risk group for falls, and yet we're seeing a 39% reduction. And if we move across to the right-hand side here, where it says SAS level 1, and SAS is Scottish Ambulance Service, and this is where the ambulance crews would notify the register where they've attended a faller. And again, we looked at the 3 months before this happened and the 3 months after, and I think the results here are phenomenal. See a 73% reduction in falls, and just think about that reduction in and emergency admissions. So I think it's a real reinforcement of the hard work that's gone into the development of the SAS pathway. And moving forward, we need to think about what the next steps are. So we're at a point where we are ready to start the implementation stage of the full strategy, and we've got groups and group leads identified. And all those change ideas that Angela was going through need to be looked at. We need to look at the data, and we need to prioritise the change ideas to see what we're going to do next, what order we're going to do them in, and where we're going to make big wins and significant changes. There's two other things running also that are crucial to the success of the full strategy. And one is the Falls register development, because at the moment we here in the Falls service have a great view of the Falls register and can use it for information, but not a lot of other people can. So we're looking at the accessibility of that and how people are able to access that really valuable information that we hold. And that project's ongoing just now in-house with eHealth. And we also are looking at our training programme and the move to mandatory education. A really good training education programme will be really key to success of the strategy. So we're well on the way with that. We're aligned with NES and possibly some national recognition for the training. So that's quite exciting, and hopefully we'll have something to report on that really soon. We're looking at a fairly short time scale for that. So there's some really exciting things happening already. And that's really as much as we'd want to say about the strategy at the moment. We really are happy to be contacted, so please just get in touch with us with any questions or just to chat. There's our addresses on the screen just now. And the only other thing to say is thank you for listening, and if you're invited to get involved with the strategy, please do. It'd be lovely to see you. So thanks very much, everybody. Bye-bye now.